almost all of it is embedded in what we call the HIV risk environment. And what is the environment by which key populations are interfacing with their environment, and how the police interface with that environment and either disable them by not allowing them to engage in effective preventive measures, not only in terms of individual risk, but prevention strategies such as treatment and prevention as well. And it looks across a wide range of economic, political, social, and physical spaces, and it looks at both micro and macro levels. And so to a different extent, the papers focus on bits and pieces, or even more comprehensively, to how this occurs. And what's really nice about this, I think, is that one, its breadth includes at least three key populations: people who inject drugs, sex workers, and other individuals at risk. But what it also does is we've seen some examples of some countries where the term police harassment, if you will, has been sort of problematic, but it sort of expands it into a much larger geographical lens. And there are some new settings where we've not seen some data before, such as South Africa, Canada, even the US, in the Mexican-US border, Cambodia, India, Mexico, and some new countries like Kyrgyzstan, Azerbaijan, Russia, and Ukraine have been well known for quite some time. And I think that what it does is it really provides also different kinds of analyses. There's systematic reviews, there's qualitative research, there's path analysis on how this police impacts HIV risk, and different conceptual models that I think brings this together. I think what's really important is that we have heard repeatedly throughout this conference that we are going to have challenges with reaching these 90-90-90 UNAIDS goals. And the extent to which this enabling or disabling environment needs to be corrected is really addressed across a large body of work. And I think it becomes a game changer. And while we recognize that it exists, I think the next generation, and what I would hope that the next special issue would do, is really talk about the successes that we have, so that if we look through the same sorts of lenses in 2, 3, 4, 5 years by 2020 to meet the goals by 2030, have we achieved those goals in changing this enabling or disabling environment across the globe in order to address the global HIV pandemic?
Thanks, Rick. I'm going to pass over to Tom now from PEPFAR.
Great. Thank you, Nick. So first of all, I'd like to say thank you for including PEPFAR, and on behalf of Ambassador Burks, I just want to say that it's an honor to be with such a diverse group of professionals and experience. That PEPFAR is usually not at these kinds of events. I think, when PEPFAR was started, I don't think anyone ever thought that we would be sitting at a panel such as this, because if you think about it, it was the President's Emergency Plan for AIDS Relief, and it was about prevention and getting drugs into people's bodies and making sure that they stayed healthy. But as we all know, as we've worked and learned more about the risk factors, and I think I would just say what Rick said about the reasons why we're here and why it's important that PEPFAR be at this table, is that we have understood more and more, thanks to a lot of this research that wasn't there but is there now, to actually establish what we've heard for years in the environment, that key populations, criminalized populations, are at higher risk because of the environments in which they live. And it makes common sense, but it's hard to have these vignettes or these stories as convincing law enforcement or judicial systems to react. So we're certainly looking forward to using this material in working with our country teams. We, of course, tap into the highest levels of global health diplomacy through our embassies to work with countries, to work with systems, to ensure that our programs have the best impact they can. And I will say that I just was in a meeting this morning where a colleague from South Africa is going to share and hopefully release soon a report that shows a significant decline in STIs and sexually transmitted infections among sex workers when those sex workers engaged in dialogue with the local law enforcement agencies. And they actually tracked and looked at this program of meaningful engagement and dialogue with the law enforcement agencies in their region, and actually started to track STIs, which of course is an indicator of condom use. So in the initial studies that were done, there were high levels of sexually transmitted infections in this population, but they were all reporting condom use all the time. Of course, that wouldn't result in sexually transmitted infections, but clearly they were not using condoms as because of the fear of being arrested or imprisoned because of carrying condoms. When they started to have this dialogue with the local law enforcement agencies and they were allowed to have condoms, the incidence of sexually transmitted diseases went down, drastically dropped. So I think that's something that we look forward to working with this group and the team and really indicating how we can work together to improve the lives of these criminalized populations and key populations. And finally, I would just note that we, in fact, Ambassador Brooks is very committed, of course, to this issue, and at the high-level meeting at the UN a few weeks ago announced our key populations investment fund, and we're actually looking at one of the arenas of investing those funds is in this idea of creating more acceptable environments for HIV prevention services, access for these populations, not only to quality services, but then retention and services. So we look forward to continuing this conversation and really improving the health and lives of these people. So thank you.
Yeah, no, thanks, Tom, and it's just critical that that Tom and Ralph are here as both of their, PEPFAR and the Global Fund begin to sort of really think about how they're going to, program to impact on the enabling environment, including, how do you engage police further, how do you support protocol developments and training. So we're going to pass on to Ralph to hear about some of the work that the Global Fund is thinking on in this space.
Thank you very much, Nick, and it's a pleasure to be here today as part of this panel. And let me start by actually telling a success story. About 20 years ago, I was on the board of the local needle exchange program in Montreal, Canada, and the city had invested a lot of money in setting up this program because there was, of course, evidence already at the time that needle exchange programs are an essential part of the response. As a member of the board, I often went to see what was going on at the needle exchange, but often the staff had nothing to do. And so I had a lot of time to talk with them. When they had nothing to do, it was mostly due to the fact that police cars were stationed in the street or right in front of the needle exchange center. So we started working in partnership with the police and educating the police about the fact that needle exchange programs are not only good for people who inject drugs, but also for the communities and ultimately for policing efforts. And what we saw is that uptake of the service increased drastically. So that's why we need to invest in these programs. We know that services need to be accessible to people and that police can be barriers to that, but they can also be partners in our efforts to fight AIDS. And that's why the Global Fund, in its new strategy, has a very strong human rights objective. The goal is to do a lot more in countries around the world where the Global Fund invests to reduce all human rights related barriers to the services that the Global Fund funds. The Global Fund is not a human rights institution, it's a health financing institution, but human rights is one of our 4 strategic objectives for the simple reason that our investments will go much further if we address these human rights related barriers to services. and we are working in partnership with UNAIDS and others to make that a reality over the next 5 years. And this is one of the 7 key programs that we intend to scale up in countries around the world. Thank you.
Thank you, Ralph. I might just say that that this journal was guest edited by IDLO, the International Development Law Organisation. One of the guest editors, David Patterson, is here in the room with his great friend and colleague, Professor Nick Crofts, from the Law Enforcement and HIV Network, which is really one of the main sort of NGO sort of think tanks that has really been driving this engagement with police, like police-to-police engagement and dialogue, setting up country focal points in difficult parts of the world to actually have a way so we can actually talk with police. If I want to go to Ukraine and I want to talk to a police officer, I can't just pick up the phone and call the police. We need people who are police to be able to broker that relationship for us, and we're really lucky today to have Wamala Twabo with us, who are a former Ugandan police officer who actually is the Law Enforcement and HIV Network country focal point for Uganda. Wamala.
Thank you very much for that kind of introduction. A former inspector detective of police. You may be wondering why a policeman on the issues of drugs. My journey was quite several years back when I was a person was working in the narcotic department, a department that was supposed to enforce the law, looking on the issues of drugs. From the beginning, I started becoming a friend of people who used to sell drugs on the street, because it was my journey and it was my work that I was supposed to do. So within that kind of interaction with the people we used to call criminals, I ended up becoming one of them. So the way we work, when I was doing that work, I looked at that there was something lacking within our law enforcement department, within the sector, that I, as a person, that I really discovered that we really need to work with the community who are using drugs, not just to only seeing them as criminals. So I learned a lot of lessons, that these people were not criminals, we used to say, because someone using drugs has not committed an offense, because not any person that uses drug is a criminal. So sometimes you could find that the law gives us punishment for these communities. So I came up to give light to my fellow policemen and the law enforcement that what we are doing, it was right. It was not right, but only to support these people, to come out, support them, to have treatment, and to let their health and rights protected. So police officers or the law enforcement are not just hard people. It's only that the approach that we always use is always poor. Like the organization use bad approach, and at the end of the day, they end up blaming police is doing that. In most cases, I've been interacting with the police on quite several times as a focal person for Lean, and I've seen police being supportive in these activities. For example, like when people are having being arrested on the issues of drugs, we are being called by the police to come and take these guys to rehabilitation center. But that one has not been done countrywide, but to some police stations, that people who have understood the terms of harm reduction concepts, they are coming on board. What they're only lacking is just they don't understand what is the relationship between drug use and HIV. And that's an area that has been left out. I thank God that Lynn is coming on board to highlight and educating police officers on the issues of human rights, on issues of drug users, to understand that if a drug user is HIV positive, the person does not sleep who is a fellow drug user. A drug user has a girlfriend who is not a drug user. At the end of the day, you find the HIV is moving within from one person to another. And you find the police is also becoming a victim because the person I sleep with may be a girlfriend of a policeman. So when we keep putting these guys under the bars, we are not helping, we are just increasing the HIV. It's good as that we former police and the current police officers, we talk to one another. We understand the languages and we understand the needs. There is a lot of department within the police unit in different countries working on issues of health and HIV. So those has been our entry point, to bring the police on board. But what is lacking is that the capacity, we don't have enough capacity, and Lean as a global network has not been having enough resources to make sure that this awareness goes down to a policeman who is at the police station. So we really need a lot of support in this, so that in order to reduce HIV 1990 by 2013, let us bring the police on board. Let them be educated on the issues of drug use and HIV. Let them understand the issues of human rights. Let them understand that drug users are not criminals, only the people who are sick and need treatment. Because most of the police officers, some are drug users, and they need services, they need help. But they can't get help when we still keep close our hands. Let us fight together, come on board, and we support Lean and other organizations and other countries where this Lean has not reached, so that the Lean reaches on the ground to educate these police on issues of human rights, to educate police on how to handle a drug user and how to know that these drug users have rights and they need services as well like any other human beings. So let this be a collective effort that we all need to support, not for a fight for one person. Let us all embrace it with our development partners, support us, and we fight. At the end of the day, we find HIV is reducing among the key population.
Fantastic. Well, Marla, thank you so much for that, inspiring call to arms there. I'm going to hand over to Mr. Ahmed Shahata now from IDLO, working in the MENA region, which you're going to talk us to about how some of the examples of how the engagement between civil society and police is going on. Thank you.
Thanks a lot, Nick, for this great introduction. As we all know, a legally enabling environment is critical and crucial to the response of HIV in every region, not only in the MENA region. Police, prosecutors, lawyers, everyone should be involved in the response to HIV, and also to reduce the harm of HIV/AIDS on key populations and people living with HIV. In 2013, IDLO and its implementing partners in the Middle East and North Africa initiated some thematic discussions on annual purpose or an annual basis. And throughout those thematic discussions, we were able to design some programs to better engage police when we provide HIV-related legal services to people living with HIV and key populations. IDLO and its partners were able in 6 countries in the MENA region to design 6 programs to provide legal services and engage police in these legal services. For example, I'm giving some concrete example in the MENA region. For example, in Algeria, we have our implementing partner, AIDS Algeria, has an agreement with the Ministry of Interior to train police officers. That is with the support of the Ministry of Health and also the UNAIDS and UNDP. And until now, over the 2 years, they trained around 210 police officers on the nexus between HIV and law, the importance of defending the rights of people living with HIV and key population, and how that reduces the risk of the transmission of HIV. In Egypt also, El Shihab organization is one of our implementing legal partner, and also they engage police in the legal literacy programs that they provide to their people living with HIV and key populations. And usually they have focal police officers in different government rates in the country that they are dealing with in case of arrest or in case of any violation of rights of people with HIV. And also in Jordan, there is a unique example when they use the media to promote for the people living with HIV rights and key populations rights, and also that makes kind of indirect sensitization to police officers on public TV. Also, I have other two examples. For example, in Lebanon, our partner was able to organize roundtable discussions with police officers at the Ministry of Interior on a quarterly basis. These kind of discussions brings down the police officers, lawyers who are providing legal services, and people living with HIV and care populations. They have to all sit down and discuss how they can work all together to prevent the address HIV. Also, one and the last example, for example, in Tunisia, our legal partner also have an agreement with the Ministry of Interior to, instead of tracking drug users when they get arrested in the street, taking them to detention centers or at the police stations, they send them back to the organization to receive prevention treatment. They receive they put them in syringe, needle and syringe exchange programs. They put them on OST, and they take the services instead of being pushed in the prison. So all of these are very progressive examples, are very concrete examples. We consider them, and in a hostile and fragile region like the Middle East and North Africa, we see now. I mean, the political situation is not supportive, and however, we're trying all to work there, and we're trying to support them. As a next step for this, we need really to work more, and we need to support these kind of initiatives. We need to work with them more. We need to bring more police officers on board. We need to have more organizations working with police officers, and we need really to build a great bridge and strong bridge between civil society and police. So that's all, and quickly from my side.
Well, that's fantastic. I think what we're starting to hear from our last two speakers is, obviously the complexity of different countries and different regions, not only the political complexity, but the complexity of actually engaging with different departments within policing. But what we're starting to see is that there are, a growing number of examples that are happening at sort of definitive local level area efforts. And it's a matter of trying to join these efforts up so we can continue to take these efforts to scale. On that note, we're honoured to be joined on the panel here by Luis Luvrez, who is the Deputy Executive Director, Assistant Secretary General of the United Nations, and a terrific champion working with his Executive Director, Michelle Sidibe. And it should be noted before we hand over the floor that Michelle Sidibe provided a forward for this special issue of the Journal of the International AIDS Society, and I encourage you to either access it, open access online, or pick up a hard copy, of which we have 300 here, just hanging out here in the room. I'm going to pass on to Luis. Thank you.
Thanks very much for convening that. We heard many examples, and salute special the representative from Ghana that I think was quite graphic. I would like to bring this back to the context of this epidemic today. In a nutshell, what I see in Durban is a new picture of the epidemic. There are basically two major develops as we speak, two trends going on. One is that deaths are going down in most of the regions, minority Eastern Europe and Middle East, but there is a global trend of death going down as a result of expansion of treatment. On the other hand, infections are going up, mainly on key populations. What is stable at the best? And let me tell you, stable is not good enough. If we have a curve like that, the risk of moving up is always there. The way that I see, we are very soon hitting a paradox that will paralyze the AIDS response. If trends continue like that, AIDS will come back fully, everywhere, to every population. That's the picture in Durban. The reasons for that, we saw, this is a press conference as I understood, the South trying to go on detail is fundamentally the lack of rights, the discrimination, the lack of inclusion of the populations where we are seeing the rebound, the re-emergence of the AIDS epidemic. If I'm a gay man today, AIDS is fully back, unchecked, everywhere in the world. It's a global epidemic. Again, the pandemic of AIDS is equal to the increase of this epidemic among gay men. If I take drug users, they are largely unchecked. I said it before, they continue to die as in the 80s in Eastern Europe. For instance, we have a growing epidemic of drug use coming to Africa, as the police officer just told us. There is a major risk there, an emergency in terms of AIDS. What was before limited to some continents is becoming now more and more a global challenge, more than before. And there you go. If you take sex workers, the trend is the same. In this country, the rates of AIDS among sex workers are as high as 70%. In countries like Zimbabwe, 60%. We are talking a lot about young women. These are young women. Just they are more affected than the rest. And then this is the context, because if criminalization, if we don't change the way that society is dealing with these populations, and in many cases the police is the point of contact, because these actions are criminalized, being same-sex relationship, being drug use. The police in many cases is the first point of contact. Is where you have probably part of the problem, but it's fundamentally where we are start to have hope to change. Society related to these populations basically through criminalization. And if we don't bring this down, the future of the AIDS epidemic will be doubtless. What we are starting to see today will become a global emergency. That's why it's in that context that I think this discussion, this publication by us, it's absolutely important. It's like you could not be more timely, even if we didn't see the trends until recently. Look, the trends that I'm talking to you about, they are only we only saw that when we decided in the last few months to do an analysis on the last 5 years compared to the rest. The narrative that we are seeing on AIDS, because you are journalists, but you understand that we are working in a longer time. We could not see the trend that only is coming now from the very few years. It's a very short trend. You see only this increment if you cut the trends of the AIDS epidemic in very short intervals. We did that, and that's what we found. Thanks.
Thank you so much, Luis. It's I remember being in Melbourne in 2014 with David and Nick Crofts, and with support from the Open Society Foundation, and we had a panel discussion pre-conference about this important relationship between police and key populations, and how we really needed to sort of start to program and get this on the agenda. I made a comment at the time that if this was such a critical partnership, then why in 2014 were there only 6 police officers at the International AIDS Conference in Melbourne? So we come forward 2 years to Durban in 2016, and I'm pleased to say that there's an enormous number of police officers at the International AIDS Society Conference standing outside, checking bags, heavy engagement of the police in the conference. Not necessarily the type of engagement that we'd like to see taken to scale, but nonetheless engagement. But I think we actually do have about 15 to 16 police coming into a closed door meeting in about an hour's time, so we can actually start to unpack at a little more scale than we have previously. I think in 2016, if the take-home message has to be that the time has come to engage fully and wholeheartedly with ministries of public security, ministries of interior, police, and the military, and how we program in the HIV response. I remember saying to Ralph in a meeting in Geneva in April, how many direct Global Fund grants had actually gone to national police departments, and the answer is very few, if in fact, if any. So it's how do we, if we want police to be part of this solution, we have to begin to program to engage with them. And I think that's kind of the take-home message that we want to learn from this. And some of the examples that are coming out from the MENA region and from Uganda and other places in the world where this is being done, indeed in Canada, what Ralph was referring to, we know how to engage. We're developing a large network of people who are doing this. The special issue speaks to it, and I encourage you all to really sort of take this message forward as you go forward in your work. I'm going to hand over to the floor for some questions, and if there's no questions from the floor, I'm happy to start off some questions myself. If you could just say your name and where you're from, that would be great.
Hi, my name is Hillary Beard. I'm from the U.S. and I am leading a team of journalists, volunteer journalists from the United States who are African American, who are reporting back from this conference to the U.S. So I'm still actually formulating several questions, but it won't surprise you to know that this is a really important issue for African Americans in the United States who are over-criminalized and over-incarcerated. And so the Lancet publication that came out the other day showed that mass incarceration is driving HIV rates in African American communities in the United States. And one of the issues so I'd like you to speak about the intersection of this issue with that. And one of the issues that was not written about in the issue, but that we kind of mined as we were talking about it, is that there are 10 times as many people who are cycling in and out of jails as are cycling in and out of prison. And so that's a point of contact that's not identified in the journal, but touches far more people, and there's not any good data about it. So I'm wondering if you all will just riff a little bit about African Americans in the United States, because I think, if I understood you correctly, the U.S. study in the journal is on the border, but not necessarily among African Americans, who are by far the most criminalized population in the U.S.
First of all, thank you for the question, and thank you for leading a group of journalists to ask these very important questions. So the first part of the question is a really important one, and how are the two issues between the Lancet series yesterday and this particular series on policing related? And the sort of wave is that, there's a series of laws which are not human rights based, which basically form the platform. And so that is a place to begin to do some changes. But it's the police who differentially can enact them. And there are good data from the US to suggest that those policing activities that result in the over-incarceration of especially African American men, but African Americans in general, is based upon some of the differences with regard to policing. There have been some examples in the US where that has changed, and I'll give you at least one example. One of them has been where they have actually increased community policing, where the policing are part of the enabling situation. They work with the community, they're working in their own neighborhoods, they're actually helping keep the community safer. They're engaging with individuals who, for instance, may need addiction treatment and helping to promote treatment rather than arresting them and putting them into the system. Now, the next part of the system is, of course, whenever the laws are enacted by the police one way or the other, it results in detention, which is primarily jails. And so you have this rapid cycle, and part of what happens with the jails and this rapid cycling that goes through there is that there is a directionality, and it's mostly driven along poverty, but also along racial lines of who gets representation, et cetera, and who ends up going to prison. So that is what I would call the mainstream driver to prison from jail. But there's also inadequacy of having sort of public defenders and other sorts of things, this inequity that happens that contributes to that. Each and every place in the criminal justice system, which starts with our laws, all the way down to probation, parole, jails, and all of this, are places for intervention. And the police is actually really the first step after the interpretation of law. So I would even say we need to go back one step further and change the laws, but we can and still should be working with the police until those laws get changed. And so I don't know if I've answered your question, but I think that that's really the issue, that is at hand here. And of course, we don't have to look very far to watch the news to see what's happening with regard to police-racial relations. It's atrocious and quite scary and frightening right now.
So I'm still thinking out loud since nobody else is standing behind me. So it's interesting that you mentioned community policing. I guess I'm having two reactions to that. One is that, yes, I see that if a police officer embedded in a community were educated about HIV and AIDS, and right, they could be very helpful. On the other hand, that police officer is not going to be embedded in your community, right, in your neighborhood, right? Where rates of drug use are similar, right? Or in mine as a relatively affluent African American, right?
So there's a couple of things, and I'll try to use Ralph's example and bring it back to my own community. New Haven, Connecticut, which is where I live, was the first community policing that occurred in the U.S. And it actually grew out of the HIV epidemic, and it grew specifically out of the concern that we had introduced the first needle exchange in the U.S. In the New Haven and in Boston. And one of the issues that we were having is the police chief at the time, his name was Nick Pastor, really a legendary guy who really wanted to change this, but it was really the HIV epidemic that really drove him to get the police to really begin to engage with the syringe exchange program, with people who inject drugs, to help work with them in treatment. And so I think that you're right, it's not just specifically in communities that are disproportionately affected by drugs and stuff like that. There needs to be sort of a broad generalization, some cross-cultural training. What Nick Pastor did was he established an ombudsperson to be the liaison with the community, and that person worked very, very closely with the communities and the police to actually have public dialogues and really cross-cultural training that occurred across a number of those lines. Now, I will say parenthetically that trend has reversed in New Haven, but for many years I think that we did see a big difference where our arrest rates, where the pockets of the epidemic occurred, and actually in New Haven is one of those successes where we had needle exchange, we had ramp up of opioid agonist therapies, etc. But we also had community policing, which made a big difference during that. But you're right, it can be polarizing depending upon where the communities are and how people see their community in terms of how they actually police those activities. So I think you're right. It's a double-edged sword, but I always tend to go with the duller edge of the sword, if you will.
Thank you. My name is Nicholas. I'm a freelance writer. I'm doing a piece on HIV criminalization for Australia's The Saturday paper, and I'm also an HIV activist. I'll just wait for that screaming to die down. Okay. I'm not really interested in talking about several key populations, but one that hasn't been mentioned in this release or on stage here today, I believe, is MSM populations who are criminalized around the world. Does this report, I've got two questions. Does this report look at MSM criminalization?
So I'm glad you asked that question, because if I had a chance to be able to come back and comment, I think that you're absolutely right for bringing it up as an important issue. It is an omission from this. It was a call to action. It was a call for papers. And in some of the regions where I work, I'll give you some examples of where it is quite problematic. I mean, we have the morality laws in Russia, and that's expanding. They're trying to push it into Kyrgyzstan and a number of other countries that are part of the new economic unions. And so we see a trend in that direction, and it will be important to see how the police begin to enact these laws. We already see in that region that there is a reduction in HIV prevention because the NGOs that were previously funded are no longer able to do their work. And so that is a potential problem. But it also has a role in other places like Malaysia, where I also work, which has anti-homosexuality laws. And the way that the police exert their influence there is really quite dramatic. It's dramatic in terms of the way that they will go into gay clubs, and they will actually arrest people And the way that they do it is they actually put them on video camera, put it on the evening news, and they have everybody march through as they're giving a urine sample. And they don't arrest them, but they're terrorizing them in a sort of a public way. And even though that wasn't covered, I think that the policing has got to work with all populations is where the epidemic is expanding globally. And we're starting to see some movement. I think that our colleagues from from Uganda will actually speak to where their laws have actually probably impacted it, and I would be interested in some of the personal experiences, but you're right, it's a deficit in this particular thing, we just didn't have the papers to present.
Just before your second question, Ralph, you wanted to add something?
Yeah, just to say for the Global Fund, there's it's clear that in countries where gay men and other men who have sex with men face repression by the police and cannot access services, the Global Fund will fund such services. We also will not fund these services in isolation because they are part of a package, and in fact we've reviewed the evidence of all the interventions that can address these barriers, and so we would fund programs to know your rights campaigns for sex workers and for people who use drugs and men who have sex with men, so that people know their rights and can assert their rights. We will fund legal empowerment so that people, if they suffer violations of their rights, they can claim their rights. We will fund police education programs and either fund police but also fund the communities to work with police, and there's great examples of such work that has, for example, been funded by Open Society. And we fund all that while we also fund the larger efforts to change the laws, policies, and practices. But because we know that those efforts take a long time, we need to fund a lot more of these programs of police and legal empowerment and know your rights campaigns, because they can make an impact on people's lives right now while we work on the longer term efforts to change the laws.
Great. Sorry, Tom wants to say something as well on that.
Yeah, if I could, I think you're absolutely right. I mean, from just the burden of disease within key populations, MSMs, they're a disproportionate, an extremely high portion of that burden. And we've seen that, and actually one of the competing press conferences with Elton John in a little bit is for PEPFAR and the Elton John Foundation are announcing, I don't know if I can give this away. Well, I'm going to, but anyway, are announcing an emergency response fund that we are funding along with the foundation to actually address this issue of MSMs being arrested or needing safe houses or places. Now, of course, the reason this work is so important is because you don't want to have that emergency response, right? You want to try to deal with the issues in the environment and working with police before, or law enforcement and judicial system before you get to that point. But it's a huge issue. It's a huge barrier to MSMs in most of these countries accessing and being retained in services.
I'll be very quick, and thank you for now I don't have to go to the Elton John press conference. That's great. A question around attitudes to policing and approach. I noticed in the language of this press conference and the language of the presentation today, we're talking about civil society having to work with police. We're talking about having to fund police programs. I wonder if this is not an indication of a culture of obstinance amongst policing culture and the police, and how willing these police institutions are to actually work with civil society. We're seeing in Black Lives Matter that peaceful protests are being targeted and are being subject to militarized policing. I'm just wondering if the report kind of has any light to shine on that.
Yeah, just quickly before I hand over to Ahmed, just a couple of reflections on that question. Thank you for the question as well. I think if you look across globally, where concentrated epidemics amongst key populations, and you actually go into the national police websites or do a little further investigation, in the majority of these countries, what you will not see is a standard operating protocol for working with key populations, whether it's drug user, sex worker, MSM, etc. And so I think, from a very practical perspective, the development of a protocol, would take a former police officer or a current police officer or indeed a consultant would take about 3 days, to actually develop a protocol. Implementing that protocol through engaging with high-level police leadership. It might take a little bit longer, but it shouldn't be unreasonable. And then once that is implemented, then you can go forward. Without that protocol, it's very difficult. So a very direct ask here is that we work with police agencies in concentrated epidemics to get these protocols into play. And I think we're a long way forward there. The second part of your question around civil society having to pay for police training, I don't think that's correct. I think what we're asking for, police training, once something is implemented or designed, is not actually that expensive. And I think we would actually like host governments to be part of that. The United Nations Office of Drugs and Crime has developed an excellent police and HIV manual, which we're starting to see implemented. It's translated into Farsi, into Russian, in some very far-flung places in the world. So I think we have the tools that are relatively inexpensive. The final point, though, is that dialogue between that communication, and I think that does need to be supported. And I don't think it should be civil society that bears that weight. I think as Ralph and Tom begin to start their programming with this sort of vision, that dialogue platforms, whether it was every 3 months or 1 month or 6 months can be extremely fruitful, and one of the papers does actually talk to that. It's a conceptual roadmap towards enhanced enabling environments and partnership. A comment here from Patrick.
Yeah, and thank you very much, Nick. I think you've really touched upon the point about the necessity of dialogue, of creating this space that allows for conversation and for political leadership, because ultimately what we are talking about here is the bringing together of a constituency that has a role to play in the AIDS response, and bringing at that same table the people who are working on health, on HIV issues. And this is a role that UNAIDS has and can play in creating this space that allows the police, together with the health stakeholders, to see the responsibility in stopping harassment, in stopping unjust and unlawful arrest, but also showing leadership in the AIDS response. And in the countries where this is working, you can clearly see that the police conceive themselves as having a role to play in the context of health. And this is what we need to expand, this responsibilization of the police within the AIDS response, having this necessary high-level dialogue that ensures that the authorities in charge of the police, the ministry is responsible for the police, together with the ministry is responsible for health, come together and chart a way forward. And this is a role that UNAIDS is available to play globally, but also in some of the key countries where such initiatives will need to be scaled up.
Rick, you want a quick comment?
So one of the real challenges in doing this work is you really have two cultures. You've got public safety, which is your police. The same applies to other parts of the criminal justice system, prisons. So there's some lessons that can be learned between the two. And then public health. And those cultures are often very, very diverse. And they have a different mission and they have a different mandate. And so finding that space where the two coalesce is really important. And I want to actually point to one of the places that I have found in prisons, but also it came out in one of the papers that was done along the Mexican-U.S. border, and it's really aligning, how police might have a stake in this. And so if they don't really care whether people get infected with HIV, which may very well be the case, and I think you have to acknowledge that up front, what they do care about are other things that have to do with their own personal safety and their own space. So let's just say they're not the benevolent person who wants to make the world a better place. One of the papers, showed that the sort of enforcement of paraphernalia laws really resulted in pretty significant needle sticks. And so finding the factors that are important to them, not getting stuck with needles, not having their children, have unprotected sex with somebody who's at risk for it, all of these sorts of things, finding out what it is that's important for them is part of that process where people come together so that they lay their stakeholders together, and finding where there's commonality is the place for discourse. So one of the papers, I think, begins to get at that other side of it, what might be important to police.
Harry, last question.
Hi, thanks, Nick. My name is Harry Husler, and I'm the CEO of TB HIV Care Association. It's an NGO in South Africa, and we do work with a number of key populations, and thanks to PEPFAR and Global Fund for the support to be able to do that. Both we provide health, HIV prevention, harm reduction services for sex workers and people who inject drugs, as well as prisoners. And there is this real conflict between the Department of Health that provides us with condoms to give to sex workers and police confiscating condoms after we've handed them out. Similarly, we have a needle syringe program, and we've documented human rights violations, actually over